Hey everyone, welcome back to my channel. I'm so glad you could join me today. We have an exciting topic to explore, and I can't wait to dive in with all of you. Do you know that up to 20% of people over 60 are deficient in vitamin B12? A deficiency in vitamin B12 is more common than you think, and it can lead to a wide range of health problems for your body and mind. Vitamin B12, also known as cobalamin, is a crucial nutrient that maintaining good health. It is essential for producing red blood cells, supporting brain function, and synthesizing DNA. B12 also helps maintain the nervous system, ensuring that nerve cells function properly and stay healthy. Additionally, it aids in energy production by converting food into glucose, giving the body the fuel it needs to perform daily tasks. Sound pretty important, right? So, can you imagine how devastating it will be for your body if your vitamin B12 levels are low? Well, unfortunately, your body cannot make vitamin B12 on its own, so you have to get it from your diet or supplements. Many people don't get enough vitamin B12 from their food either because they don't eat enough animals products or because they have trouble absorbing the vitamin from their digestive system. This can lead to vitamin B12 deficiency. This is why in today's video, we'll be uncovering 10 key signs that could indicate you have a vitamin B12 deficiency. Without any further delay, let's jump straight into the 12 signs of vitamin B12 deficiency. Number 1, numbness and tingling. Vitamin B12 is essential for maintaining the health of nerve cells. This is because vitamin B12 plays a crucial role in the production of myelin, the protective sheet that covers nerves. Myelin is a fatty substance that surrounds and insulates nerve fibers. Thanks to myelin, transmission of electrical impulses between our nerve cells is rapid. However, inadequate B12 disrupts the formation of myelin. The result is slower or blocked nerve impulses. Symptoms occurs in the extremities such as the hands, feet, arms, and legs. Some people may also experience it in other parts of the body. Neurological symptoms are seen in 20 to 30% of vitamin B12 deficient individuals, but this can be higher in severe cases. In fact, a case study described a 45-year-old man who experienced numbness and tingling in his hand and feet, along with difficulty walking. Neurological examination and MRI scans showed signs of defective myelin. He was diagnosed with B12 deficiency induced peripheral neuropathy. Number 2, heart palpitations. Heart palpitations can be a noticeable and concerning symptom of vitamin B12 deficiency. A deficiency in vitamin B12 can lead to a decrease in red blood cells, resulting in a condition known as megaloblastic anemia. This type of anemia causes the body to produce larger immature red blood cells that are inefficient at carrying oxygen. To compensate for the reduced oxygen carrying capacity, the heart has to work harder, often resulting in palpitations as it tries to pump more blood throughout the body. Heart palpitations are reported by around 15 to 20% of those with low levels of vitamin B12. Patients describe the sensation as if their heart is racing or pounding, especially during physical activity or when climbing stairs, as the body demands more oxygen. Number 3, anemia. As we just stated, vitamin B12 is needed by your body to synthesize red blood cells. The lack of this crucial vitamin means that the process of red blood cells production won't go smoothly. As a result, the bone marrow produces unusually large and immature red blood cells that can't perform their function properly. This type of anemia is called megaloblastic anemia, which is Latin for large cells. It can cause symptoms such as paleness, shortness of breath, and dizziness. Anemia is present in about 50 to 60% of those with a vitamin B12 deficiency. Number 4, fatigue and weakness. Fatigue and weakness are among the most common and noticeable symptoms of a vitamin B12 deficiency. These symptoms occur because vitamin B12 is essential for the production of healthy red blood cells, which are responsible for transporting oxygen throughout the body. Without enough oxygen, the body's cells can't produce the energy they need to function properly, leading to persistent tiredness and a lack of physical strength. This is because oxygen is the most important part in the chemical reactions in your body that produce energy. This type of exhaustion won't seem to go away no matter how much you sleep or rest. Approximately 80 to 90% of those with low vitamin B12 levels report experiencing constant fatigue and weakness. Number 5, mood disturbances. Mood disturbances are a significant and sometimes overlooked symptom of vitamin B12 deficiency. A lack of adequate vitamin B12 can directly affect brain chemistry and the nervous system, leading to emotional and psychological symptoms. Vitamin B12 is crucial for the brain health and the synthesis of neurotransmitters such as serotonin and dopamine. In case of low vitamin B12 levels, the synthesis of these chemicals is markedly reduced. These are chemicals in the brain which regulate mood, cognition, and overall brain function. Mood disturbances are reported by 15 to 20% of those with a B12 deficiency. Number 6, cognitive impairment. Cognitive impairment is a significant symptom of vitamin B12 deficiency and can manifest in various ways, including memory problems, difficulty concentrating, and slow thinking. The reason for this is that vitamin B12 deficiency can also increase levels of homocysteine. Homocysteine is an amino acid that is toxic to your brain cells. It can damage brain cells and blood vessels, contributing to cognitive decline. Around 20 to 25% of individuals with B12 deficiency experience cognitive symptoms. Number 7, breathlessness and dizziness. Breathlessness and dizziness can result from anemia due to B12 deficiency, as the body struggles to get enough oxygen to the tissues. As a compensatory mechanism, your body increases your breathing rate to get more oxygen inside it. Patients with low vitamin B12 levels experience excessive breathlessness, even with mild exertion, such as walking up a flight of stairs. A lack of adequate oxygen can lead to poor circulation, making the hands and feet feel cold, which can contribute to a sense of overall physical discomfort. These symptoms are reported in approximately 20 to 27% of cases. Number 8, glossitis and mouth ulcers. Glossitis means inflammation of the tongue. If you take a look at the tongue, you'll find it swollen red, shiny, and smooth. This condition can cause discomfort, pain, and difficulty in eating and speaking. In addition to that, mouth ulcers are also common. These symptoms arise because B12 is essential for DNA synthesis and cell production. To clarify, this means that your old cells are removed but aren't replaced by new cells. Over time, the superficial layer of cells is eroded, producing ulcers. Adding to that, the epithelial cells lining the tongue and mouth require regular replenishment. B12 deficiency can cause these cells to become abnormally large, disrupting their normal structure and function. Number 9, infertility and reproductive issues. Infertility and reproductive issues are lesser known yet significant symptoms of vitamin B12 deficiency, affecting both men and women. Vitamin B12 is essential for various biological processes, including DNA synthesis, cell division, and hormone regulation, all of which play critical roles in fertility and reproductive health. Low B12 levels can disrupt these processes, leading to challenges with conception and a healthy pregnancy. To give an example, a woman suffering from vitamin B12 deficiency may have eggs with chromosomal abnormalities. This reduces the chances of successful fertilization and increases the risk of miscarriage. Furthermore, if less oxygen reaches the testicles of the man due to anemia, then he will produce less sperms. Reproductive issues are reported in around 10 to 15% of individuals with a B12 deficiency. Number 10, hair loss and skin changes. B12's crucial role in cell reproduction, oxygen transport, and maintaining skin and hair growth. Low levels of B12 can disrupt these processes, leading to visible signs such as hair thinning, dry or flaky skin like hyperpigmentation, and hair loss issues, which is the abnormal darkening of areas in the skin. All these different manifestations share a common cause, which is not receiving adequate oxygen. Hair loss and skin changes are noted in 10 to 20% of cases. Patients report increased hair shedding when combing or washing their hair. This shedding can be diffuse, affecting the entire scalp rather than localized patches. So, these were the top 10 signs you have a vitamin B12 deficiency. You can add vitamin B12 to your diet via eating fortified foods such as plant based milk, breakfast cereals, and nutritional yeast. Or you can get the required amounts by taking vitamin B12 supplements, which are available in a variety of different forms. You can take them in the form of pills, injections, or tablets that are placed below the tongue. Now, we want to hear from you. Have you or anyone you know experienced any of these signs before? Was it due to vitamin B12 deficiency? Thank you for watching. If you feel this video could help others too, give it a like and share it. Your action could be just what someone else needs.